You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, no more dentures. With us, we have an expert on the topic, Dr. Woody Domingoes. Dr. Domingoes, welcome to the program.
Thank you, Randy.
Now, for people that don't know you, I know you brought some photos, so we'll have time for those and some models. But for people that don't know you, I guess it's you and your wife are both dentists.
Right.
What are the different services you offer? Like, who's your typical patient?
Right. So we're a general family practice in St. Augustine, Florida. We offer lots of high-tech solutions to dental problems. An example would be a machine that we have that makes crowns or caps for teeth in a single visit. Where
like in the same day?
In the same day. So we'll have a wand, if you will, that we put in their mouth and can scan the tooth, no impression. So now we also make crowns in the same day. We have a wand, a small little wand that we scan inside the mouth and can fabricate that tooth all in one visit. So it's a fantastic thing that we can do now.
So while they wait?
While they wait. You know, typically the procedure takes hour and a half to make a tooth. And people are just amazed that they watch me design it on the computer screen and say, why doesn't everybody do this? And I said, well, everybody doesn't know about it.
So you were one of the first that had this, I guess like it's a lab right there in your office?
That's right. It's kind of like a lab in a box. You know, it's a fantastic piece of technology that allows us to design that crown or cap or veneer or whatever it needs to be in one visit. And patients are just extremely excited about it.
Okay, what else do you do there?
We do root canals, which everybody seems to be scared of, but which are, with the technology that we have now, are just a painless relief for
the fun root canal.
The fun root canal. I routinely have patients fall asleep
during the root canal.
During the root canal.
So it doesn't have to. Okay. What else? What else you got?
We do Invisalign, which are clear braces. You know, where we don't have any wires, we don't have any brackets. Patients love that. They're the type of people that have that are older, that don't want to explain to their friends why they're wearing metal brackets, railroad tracks on their teeth. They don't have to go through that. So another part of our practice, a big part of our practice, is cosmetic smiles, rehabilitating smiles, rebuilding people's self-esteem through beautiful porcelain veneers and crowns and restorations. Some of that can be done with our in-office technology, where we can do it in a single visit. Many times we use a laboratory for it, but the results are always fantastic. Beautiful, beautiful results. And who are the people that we do it on? Just about anybody. I mean, we've done them from teenagers to 85-year-olds, and really it just comes down to, are you happy with what you have?
Now, we call them, or you see in the news media, like a smile makeover.
Yeah.
Do you call it that?
We do. We call it.
And I think we talked to the folks. You say it's like it transforms people's lives, even if it's with dental implants or with porcelain veneers.
That's right. Yeah.
When you say it transforms their life, elaborate on that.
People will at the first visit, once we've kind of hold the mirror up and let them see what we've accomplished, they cry. And I don't ever let anybody show them their temporaries, because I want to be in the room when they see what that first visit, when they come out, because that to me is the most fun part of the whole thing. All the work and everything else that we go through to get there, to be able to see them really enjoy what they've come for, and to be able to change how they feel, because maybe they've been hiding behind a napkin or hiding behind their hand or talking into their hand for so many years, waiting, putting it off, having so many reasons why they couldn't do it. And now they finally made it, and it's better. They expected something, but they got something so much better. It ends up just being a fantastic moment. So it all comes down to that one moment when they hold that mirror, and it's really exciting. And I really, really enjoy those times.
So moving on to dental implants, and for people just tuning in, we're talking about replacing missing teeth with dental implants, and according to Dr. Domingoes, no more dentures. So when you say no more dentures, what do you mean by that?
I mean not having teeth that are just sitting on your gums and floating around in your mouth. I had an instructor in dental school who said, a lower denture floats like a canoe. That was his tagline. And so whenever anybody complained about their lower denture, he just said, that's the way it is. It floats like a canoe. And it doesn't have to be that way. Doesn't have to be that way anymore. So the future right now, what we're doing all the time in our office now is implants to fix teeth in place, giving people something to chew with that's comfortable. And for years we have done traditional surgical implants where we place 2, 4, maybe 6 implants to lock a denture in, or maybe eliminate a denture completely. And those work great. I've done many of those myself. But the thing that I'm most excited about now is mini implants, because there was such a group of people that regular implants were such a hardship for. You know, I would sit down and have a conversation with somebody about...
And we're talking about denture wearers right now.
Denture wearers.
Okay.
I would sit down and have a conversation, and I'd say, they come in and they say, I'm not happy. You know, the dentures you made me, they're uncomfortable. I said, well, this is it. This is the best we can do. We've relined them. We've put a soft liner in them. We've done everything that we can possibly do to make these things better. Have you thought about doing implants? Oh, I don't want implants. So why don't you want implants? And, well, you know, I'm too old. I'm too old for implants. And I say, well, you know, my oldest patients are in their 80s. Well, they're too expensive. You know, I've heard about implants and they're too expensive. I know somebody had them. And I said, well, we have ways that we can take care of that. You know, there was always an objection, but and the other thing was time. I'm 85 years old. How long am I going to have these things? I don't want to spend a year waiting for these things to heal so that I can wear my teeth. And isn't it painful? You know, am I going to have a lot of pain while we're waiting? And honestly, when we were doing surgical implants, there was some discomfort. We don't use the word pain, but we use the word discomfort to describe what they were going to experience. And you know, a little bit of pain for some gain, no problem. You know, everybody can get through just a little discomfort for a good outcome. So now with mini implants, I can put, just with very minimal procedure, I can put a full arch of teeth that snap in, and they leave my office and go and eat. It's amazing. And this is not what we were doing before with traditional implants. Yes, we could get them eating, took longer, cost more, was more time consuming, more objections to it. I couldn't do it on patients that had health challenges. You know, there's a lot of...
So mini implants are like more than, and this is what you told me, like half of what traditional implants are. And they work.
They work wonderfully.
So when we say no more dentures, that means no more dentures that are just floating or that are attached to nothing.
That's right. These are snapped in. As a matter of fact, I brought a model if you'd like to see.
Yeah, let's take a look.
Okay.
And they're snug? I mean, you can eat with them?
Yes. Well, if you look here, they're snapped into these little implant that are sticking through the gum. Placing those in is a very short procedure.
This is like a lower denture.
That's a lower denture, yes.
So implants right here?
Yep.
And this right here, I don't know if the camera can see this.
Little snaps inside the denture that will snap right over and click into place.
So you just snap it on there?
Just like that.
Okay. And no more adhesive?
No more adhesive. And you know, I have patients that go through gobs and gobs of adhesive, and it's gone, all gone.
So they can eat like what?
They can eat apples, they can eat corn on the cob, they eat whatever they want. I have patients tell me, I said, is there anything you can't eat? He goes, nothing. I said, you haven't found anything? He goes, nothing. May not be everybody, but that's most people. So
traditional dentures are out?
They're out. So
get mini implant. And how old can you be to get this done?
There's really not a limit on age. I think it has more to do with motivation. Because if you have the wherewithal to do it, if you want to do it, I think you should be evaluated to see if you can do it.
So how old can you actually be? Like what are some of the older patients?
Oldest one, 90 years old, that I've worked on.
Really?
90 years old, yeah.
Why would a 90-year-old want to do this?
Because they want to eat. You know, at 90 years old, if you, depending on what your health level is, eating is one of your great joys. That's one of the things you enjoy most doing, is eating. Going out with your family and enjoying a nice meal.
So at 90 years old, statistically, are they more likely to fall out at 90 years old?
The dentures or the implants?
The implants.
No, the implants are going to heal just like they would in anybody else.
So are there a lot of people where you were in your town or within an hour of your practice that have dentures?
Thousands. There's thousands of people that have these dentures and are in that same situation where they could really benefit from having something to lock those teeth in place. People that are hiding from the public, not going out to eat, not eating with friends.
Is that an overstatement, by the way? People hide? People with dentures sometimes?
Oh, all the time. Yeah, I have a patient right now that hides in his house because he doesn't want to go out and eat with friends. He's worried about his teeth slipping or clicking together when he eats, or falling out while he's eating. Things get caught under them. It's not comfortable. So when somebody invites him to dinner, he's thinking, what are we going to eat? Where am I going to go? How can I make this work? Not how can I enjoy my friends? That's not his thought at all. He's thinking about what the negatives are going to be.
So if there are thousands of people,
Yes.
as you say, with an upper or lower denture, why aren't they all doing it? Why aren't they all going and getting dental implants to be snapped and locked in their mouth?
That's a fantastic question. The reason I think they don't know about it, but the reason they don't know about it is because they are denture patients. They haven't been to a dental office since they had their teeth removed. It's been years. So they might have gone once in a while to have a reline done or something like that. But if they haven't been to a dental office, how are they going to hear about it?
Good point.
Their memories of dentistry are bad. They had a lot of dental infections. They lost teeth. It was a constant source of pain and problem. They were scared of going. Those are the reasons they wouldn't go. They just are unhappy with the whole dental thing. They're scared.
So I guess if you're wearing false teeth, a lot happened for you to lose those teeth.
You went through a lot to get there. And now you're kind of done with dentistry and you're not interested anymore.
Well, nobody likes going to the dentist, I guess. Especially these people.
We're trying.
I mean, do you hear that? Do they say, doctor?
Yeah, I hear that all the time.
What do they say?
They say, I don't want all the painful procedures and all the things that have to be done to get me there. And when we explain what these mini implants are and how we get there, they're excited about it.
But it does seem painful, though.
Yeah.
Putting in this, into the bone.
Yeah. We're not seeing that happen. We give just a little drop of anesthetic at each site where we're going to place an implant, and we pop them into the bone. This is not like the older traditional implants, which, by the way, I still do many of, but it's not nearly as involved. We're not making an incision in the gum. We're not pushing gums back, which brings me to another point, which is that a lot of people are thinking they're too old or too sick to have this procedure done, and it's just not the case. So it's like microsurgery. It's a virtually bloodless procedure versus the older implant, the traditional implant, which requires an actual surgical procedure to place, where we do have some bleeding and we do have to be more concerned about the health of the patient. We're always concerned about the health of the patient, but in this case, it's just such a minor procedure. Pain is not an issue. We're not seeing that happen. I have a patient now that they nearly fall asleep while I'm placing them because it just.
Are you kidding me?
No, I'm not. There's no feeling in the bone. So as soon as we give
good point. All right.
So we give you a little drop of anesthetic.
So fear should not keep these denture wearers from coming in and doing it.
No, and
well, tell me this though. I know a couple of denture wearers.
Yeah.
At least two. They never complain about their denture.
Yeah.
Are you? Some people are happy with their denture, some people aren't?
It's that. I had a grandfather that was like that and didn't complain, but they're not going to complain to you, Randy. They're going to complain to me. And I hear those complaints all day long, every day. The typical one is a little lady patient of mine that brought in her bag of dentures and wanted me to make her another set. And that's what we did. We made her another set, and still not happy. She's one of those that never let her husband see her with her teeth out, waited for him to go to sleep before she took her teeth out, and slept facing away from him. And for years, I talked to her about placing some mini implants. She was scared. She figured she was too old to do it. Finally, she relented. We had a very good relationship. She relented, let me do it. So when it's all done, she's given me a hug. She's wrapping her arms around me and telling me thank you, because she didn't know it could be this good. She doesn't know what she was waiting for. Why did it take her so long to get to this point? She was scared. She was scared that it was going to hurt. She was scared that she was too old. And all those things turned out not to be true, of course.
But isn't it true, though, that if you've been wearing dentures for 30 years, that you don't have enough bone to do this, dental implants, to get a fixed set of teeth or a snap-in, snap-out denture?
No, that's not true. Nowadays we have technology that allow us to see exactly where the bone is. We have a CT scanner in the office, shows me the three-dimensional structure of the bone, and I can find bone to put implants in. And with the mini implants, we need so much less bone. We can put them in other areas that you couldn't do with a with a traditional implant. It gives us a whole nother range of options for patients.
Now, you like these mini implants.
I do.
Because I have a few friends. They're not friends, actually. They're guys that have been on my show.
Yeah.
That say, Randy, I don't know if dental implants, mini implants, I don't think they work.
Yeah.
What's your response to that?
I'd say that's absolutely not true. You know, some of the greatest names in dentistry are supporting them. There's many years of research behind them now. I've got patients that have had them for 10 years. It's just not true. They work.
Would you do
fantastic.
them on your own family member?
Absolutely, absolutely. You know, when you can do something for someone in so few visits without pain and create such a change, why wouldn't you do it? Why wouldn't you do it? Yeah.
Okay, so let's say thousands. You say thousands. Is it tens of thousands of upper lower denture wearers around? You know, within an hour of your practice.
Easily, yeah.
And I asked you, why aren't they all doing it? You say maybe they don't know about it.
Right.
But just suppose you could give them a tryout period, like a test drive on a car. Yeah. Would they all say, this is better?
Oh, no question. No question. I think you'd have to fight them to get them back. Yeah, they wouldn't hand them over on their own.
So they love it.
Yeah. I had this one lady in particular who I'd been talking about her. In her case, it was a partial. She was wearing a lower partial denture, and she wanted a younger appearance, but she just couldn't stand her partial. And I'd talk to her about it, and I'd say, you know, we could put some mini implants in there. We could fix this. Whatever. We finally did it, and she just lit up. It changed her appearance. It changed her smile and the way she felt about herself. She now felt like she was younger, and she was an attractive lady. And it really did make a huge difference. And so I can tell you that these people would not give you their dentures back after you did that.
And we talked. You say over the years, you probably fit people with over 500 dentures.
Yeah.
Right?
Yeah.
And they're probably going to stumble onto this program.
I hope so.
What do you say to them about dental implants?
I would say, come back and let me lock those things in there for you. You know, let me give you something fixed in your mouth that you can enjoy eating with and get some of your life back. Enjoy your foods like broccoli and corn on the cob and things that you haven't been able to eat. Come back, let me do that for you.
So the future of dentistry, I think you told me no more dentures. I mean, no more traditional dentures.
No, I can't see
They'll all be attached to like dental implant.
Yes, because I think that to go and do things the way they were done 100 years ago, when we've got technology now to make people comfortable, I think it's one of the biggest things that we can do for somebody to improve their quality of life and improve their function. Somebody that is unhealthy, who's diabetic, who can't eat the foods that they need to eat because they are unable to chew. They're getting high carbohydrate foods, lots of sugar, things that they don't need to be eating, where now they can put fiber in their diet and they could eat what they should be eating and improve their health just by having some mini implants. And now we've got a procedure we can do where it doesn't affect their medical status.
Can you have osteoporosis?
You can have osteoporosis. You can have heart problems. You can have all kinds of things, obviously within reason. But all day long, we place these things in patients that have medical issues, and we're told they can't have them because they need extensive surgery to have implants done.
Now, what about the crowd of people that their teeth are bad? And they know they don't want dentures.
Right.
They know their teeth have to come out. What do you say to that group of people?
I'd say this
because you said people hold on to their teeth too long.
Yeah. I've got a patient right now, Frank, who we've been watching him lose teeth for years and gradually falling out. One by one, we're taking them. And I've been saying, you know, hey, look, we need to do something. We need to plan on what's going to happen here. And so just in the last few months, he said, okay, I'm ready. And we are in the process of eliminating his denture, which has gotten to the point where he's using a tube of goo a week to stick that thing in there. And his wife said she's constantly going to the store to buy adhesive for him because it just doesn't stay in. So now we're going to transition him back. We're going to put his teeth back. And he's I've never seen somebody so excited about getting his teeth back. Yeah.
Do you get excited? I mean, you're on the consult and you think, boy, this is going to be good.
Yes, I get very excited about it because it is transformative. Can I show you one of these pictures?
Yeah.
This is Bob. Bob came in with his partial falling out in his hand. A couple teeth broken off. Opened his mouth, partial falls out. And I said, what can I do for you? He says, I can't eat anymore. I can't function. And I said, well, let's have you considered having some implants in there? I'm too old. This is the usual thing. I mean, I literally deal with that objection all the time. I'm too old. It's too much money. But when I explained to him, when we went over all those things, cost and all those things, he said, well, let's do it. Let's try it. And in one visit, I was able to lock his teeth in. Now,
now, by the way, you say people go in without teeth and they could walk out with teeth on the same day.
Yes.
So it's like same day stuff.
Yeah. Yeah.
So with him, those teeth all had to be removed?
No, we actually kept a couple of his teeth. He had 2 front teeth that he liked and wanted to keep. And, for various reasons, people want to keep a couple of teeth. And that was fine. It worked out great. And we were able to lock his teeth. It changed his appearance. It changed his physical attitude. Take a look at what he looked like afterwards. Take a look at this.
Wow, very nice. Very nice.
So it changed his whole attitude. He felt like he could smile with confidence now. And so it changes the way people think about themselves.
He looks younger, by the way.
Well, and I think when you smile and you can lighten your face up that way, he probably could have smiled like that before with big gaps, but that wasn't what he wanted. So to be able to smile with a full set of teeth lightens your face up, brightens you up, and I think it changes you inside. Yeah.
When you say, I'm sorry for interrupting, but when you say it changes you inside, what do you mean by that?
I mean, it changes the way you feel about yourself. And I think when you feel better about yourself, you present that to other people. You present your better side to other people. Instead of them thinking you're angry or sullen or whatever other problems they may perceive you to have, now you're alive.
Very nice.
Yeah.
Very nice.
Got another one here. If you
okay, let's take a look. We have time for one more.
All right. This is Ray. And Ray came in not a talkative guy at all. Very hard to figure out what Ray really wanted, but we did our normal exam. We took a look at his teeth. It was not in great shape. We made some suggestions to him. We told him he was pretty much going to lose his teeth. And he said, okay. He didn't seem to have any interest in doing any implants or anything like that. So we did our normal routine. We made dentures for him. Next time I saw him, he wasn't wearing them. I said, where's your teeth? I don't wear them. They make me gag. I can't eat with them. And never looking at me. So I said, well, Ray, would you be interested in, we can get rid of the palate on the denture. We can lock these teeth in to where you can eat. Would you be interested in doing that? And he surprised me by saying yes. He didn't ask anything else about it. He just said one word, yes. So all the details and all that, he didn't care. This is what he looked like the next time we came in.
Wow.
Looks like doesn't even look like the same guy.
Looks like this guy's son.
But what was more amazing to me was when he is cracking jokes with my front desk, telling corny jokes. They said, what did you do to this guy? What did you do? He's not the same guy. He's telling jokes. He's talking to everybody. And all of a sudden, he's a fun person to be around. He's a very, very nice guy. And we didn't know it. It was hiding behind those teeth. And that set him free. Giving him those implants set him free. So can you imagine how people will respond to this guy if he was going for a job interview or just out in public?
That's a good point.
What a different. And I just saw him recently, and I said,
was he smiling?
Very much so, and he's bubbly. And again, my staff came back to me and said, "What did you do to this guy? He's not the same guy." I said, Ray, is there anything you can't eat now? And he said, nothing. I said, not one thing. As a matter of fact, when I took his teeth out to inspect them and clean them and all, they had gum, chewing gum, stuck on them. I said, are you chewing gum? He said, yeah, I chew gum all the time. That's not something you typically do with dentures. And he had always been a big gum chewer, and so he was back to chewing gum.
So that's a full arch of teeth. When I look at this after, that's a full arch of teeth
that's snapped
just
in.
Locked in.
Yep, it's a full arch of teeth, and the roof of his mouth is not covered.
Like a denture would be covered.
Like a denture would be covered, right. So he's a very happy camper.
But what about people, and we are short on time, but they have bad gums.
Yeah.
And they can't get dental implants?
No. Once we take the teeth out, the infected teeth are gone, the bad gums go away. The infections leave with the infected teeth. So you've got healthy gums. When you're wearing a denture, your gums are essentially healthy. There's no more gum disease there. So that's not a problem anymore. We can place implants in those situations.
So mini implants, and in some cases you say they're about half the cost.
Half the cost.
Now insurance doesn't cover this. I guess Medicare doesn't cover this.
That's right. But some insurances cover it somewhat, but we have no interest financing available. We have ways to help people get this treatment that they want and that they need. And we love to help people change their lives, just like Ray there.
So nobody should be wearing a denture without dental implants, like attached to something.
Yeah, there's just no reason.
You believe that?
I absolutely do. I think it's the best thing that, as dentists, one of the best things that we can be doing for our patients to make them comfortable. And it's such a change for somebody who's been in a situation like this for so long, and they're just suffering. You know, if they're not doing anything about it, nothing's going to change. You got to get off the couch. You got to make a phone call. You got to do something, because it's going to stay just like Ray was there.
So as a recap here,
yes.
So if you're missing one tooth or a few teeth, get the dental implants.
Right.
And especially if you're wearing a denture, that on the day of the procedure, I guess they have to meet you one time. They come back. They can, in as little as 2 visits.
Yes.
Get this teeth, and it's done.
And it's done.
How about in a perfect world? Somebody watching this, they have a denture.
Yeah.
Okay.
In a perfect world.
How fast? What's the turnaround time if everything works out?
If everything just worked out perfectly, I'd say 1 or 2 visits to get some teeth locked into place.
But turnaround time, 2 weeks, a month?
Yeah, maybe anywhere from a day to a couple of weeks.
Is that right?
Yeah.
So there's no more excuses. If it doesn't hurt very much, right?
Yeah.
They don't complain about pain.
We have no complaints about pain. That just doesn't seem to be an issue at all. I mean, just a tiny drop of anesthetic. This is not a surgical procedure.
And is this how long have you been a dentist?
25 years.
25 years. Is this the happiest group of patients? When you take somebody that couldn't eat and chew and they were in pain to...
Anytime we make somebody smile like that, that's the happiest we get. Yeah.
Okay, good. All right. I want to thank you for coming to the show. Very interesting.
Yeah, thank you.
Very nice. So consultations?
We do a no-charge consultation. You can come in, take an x-ray, take a scan.
X-rays included?
X-rays included. We'll take a scan and see if you're a candidate.
How soon can you tell them on that first day whether or not they can do it?
They will know right away. We'll know right away.
And they always meet with you?
Always with me.
And if it's a child, they're going to deal with your wife.
That's right. That's right.
All right. So what about sedation and things like that during the procedure? Do you offer that?
We can do some sedation if they need it. We typically do a little bit of oral sedation if they need it. But I can tell you that 99% of the time, it's not even needed.
I want to thank you for coming on the show. Very interesting. Very good.
Thank you.
You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.